Exactly, like to nila iron.
Nalai pasti dia udah kasat ke bawah.
Forget na. First to আছে নাই? First to থাকিব।
Itu itu kah?
Hello student, welcome to this webinar. Today we are going to say something about hypertension, and the most important thing about this hypertension is the blood pressure measurement. So how accurately we measure the blood pressure. Today we're going to say something about this. So as you know, hypertension is one of the most common disease affecting the humankind, which can be diagnosed easily without any investigation by mere seeing of blood pressure itself. So if we do not see the blood pressure, or if we do not see it accurately, then we can miss one of the most common disease affecting the human is that is hypertension. This hypertension is so common, and it's affect all the important organ of the human body like brain. You know, in the brain it can cause stroke, which can be hemorrhagic or ischemic stroke, leading to death and disability for lifetime. In the heart, it can cause heart attack, that is called myocardial infarction, and many diseases, related diseases. Then kidney disease, even kidney failure. In the eye, retinopathy, when it can ultimately cause blindness, and many other organ systems. So you should know very well, and you should be very acquainted with how blood pressure is measured. So what is pressure now? The blood pressure is the lateral pressure exerted by the blood column over the blood vessel. So we can now see in human body that the blood is contained in a closed chamber comprising the heart and the blood vessel. So it is the heart and the blood vessel, along with it is the blood which ultimately your causes the blood pressure. So different factor affecting these organs like blood, like heart, and like blood vessel ultimately affect the blood pressure. So blood pressure is equal to cardiac output. That means the amount of blood ejected by the heart. It is called cardiac output into peripheral vascular resistance. That means the resistance offered by the blood vessels during the flow of blood. So these are two important factors. One is cardiac output, and another is the peripheral vascular resistance. So as I have told, that cardiac output is the blood which has been ejected by the heart. So the cardiac output depends on the efficiency of the heart. So any disease affecting the heart which imparts the contraction or function of the heart ultimately affect the cardiac output, thereby affecting the blood pressures. In some conditions, if cardiac output is increased, so there may be chance that may increase the blood pressure. Or there are some other conditions where the cardiac output is decreased, like heart failure. In that case, your blood pressure will be low. And another factor is the peripheral vascular resistance. So peripheral vascular resistance It depends on the health of the blood vessels. So blood vessel, that means vessel wall. So any disease affecting the vessel wall, blood vessel wall, ultimately related to the peripheral vascular resistance. So cardiac output now is equal to heart rate into the volume of the blood ejected by the heart into the aorta per beat. So every beat means every contraction, that is also known as systole. Every systole. So every contraction, during the contraction, the heart eject the blood into the aorta. Ultimately, the flow of blood into your body by the all blood vessels. So per minute, per contraction, the amount of ejected blood by the heart is called stroke volume. So if you multiply the stroke volume into the heart rate, then it is called, ultimately we get cardiac output. And approximately we have cardiac output of about 4 to 8 liter per minute. So blood pressure usually we mention as systolic blood pressure and diastolic blood pressure. And already you have seen that doctors are written blood pressure like 120/80. That means the 120 that denotes, the higher one denotes systolic blood pressure and the lower one denotes the diastolic blood pressure. So what is systolic blood pressure? So systole means contraction. So when heart contract, it emptied its content, that means blood, into the aorta. So that is called systole. So during this, the blood pressure rises because of the amount of blood at that time is ejected into the blood vessels is maximum, and during, so blood volume is increased during that time, and so pressure, so this is ultimately lead to the maximum pressure. So we can define systolic blood pressure. So maximum pressure exerted by the blood against the arterial wall during the ventricular systole or during the heart contract, that means systole. So this is called, as it is during the systole, it is called systolic blood pressure. The diastolic blood pressure is the lowest pressure exerted by the blood against the arterial wall. So when ventricle relax, so after systole, there will be a phase relaxation. That means contraction, relaxation. These are the two phases of the heart. So contraction, relaxation. Contraction means systole, relaxation means diastole. So during the ventricle relax, it is called diastole. So during that time, blood coming to the heart. So at that time, the blood pressure will remain at the lowest level. And this lowest level is known as, diastolic blood pressure. And this blood pressure, when we will write, it is conventionally written as, first one is systolic blood pressure, then you have to give a slash, and then diastolic blood pressure, and always measured in millimeter of mercury. In millimeter of mercury. So it is written as SBP slash DBP, means diastolic blood pressure, millimeter of mercury. Example, say 120, which has systolic blood pressure, 80, which is diastolic blood pressure. So 120/80 millimeter of mercury. And always it is written in even number. So if you, during the measurement, if you get odd number, then nearby, at say in about 2 to 5 millimeter of mercury, say 2 millimeter of mercury, which is near, we should take that one only. That means if it is say 121, you can choose 122 or 120 as the systolic blood pressure. So don't write 121, 123. That means odd numbers. Always write in or express in even number. So already I have told, as blood pressure is the product of cardiac output and peripheral vascular resistance. So these are the factors which determine the blood pressure, which determine the blood pressure. So let us see. So factor determine the blood pressure are, the first one is cardiac output. So cardiac output means the amount of blood ejected by the heart. Amount of blood ejected by the heart. So that means the performance of the heart is an important factor. So what is the health of the heart? What is the condition of the heart? Whether heart is disease. So it is a major factor which determines the blood pressure. The another important is the systemic vascular resistance. Systemic vascular resistance, that means the all blood vessels of the body which received the blood ejected by the heart. So systemic vascular resistance, in simple way, you can say it is the responsiveness of the systemic blood vessels. Responsiveness of the systemic blood vessels during both contraction and relaxation, during both phase of cardiac contraction and relaxation. So this responsiveness in depends on the health of the wall of the blood vessels. So any disease, or even some natural process like aging, which affect the blood vessels, which affect the blood vessel wall, ultimately can affect the blood pressure. Blood pressure. Our blood vessels are very compliant. Our blood vessels are very compliant. They are elastic in nature. They are elastic in nature. So whenever pressure inside the blood vessel or volume inside the blood vessel increases, it can it can take that amount of pressure easily without any rupture or perforation or any break or any breakthrough. So this is called compliance. This is called compliance, depends on the elasticity of the wall and depends overall health of the blood vessels. So compliance of the vascular system is also important, determining the blood pressure. Then another important, from the heart, the blood is ejected into the blood vessel, and the major blood vessel at the root of the heart is the aorta. So aorta is the major blood vessel by which the blood ejected into the periphery from the heart. So at that point of origin, there is a valve known as aortic valve. That valves are meant for, they prevent backflow of the blood from the aorta to the heart. So they open only in one side. That means when heart contract, they eject the blood out, and that time the valve open, wide open, giving any resistance, without giving any resistance to the flow. And after it is ejected out to the aorta, then valve is closed, and it prevents the black flow of blood from the aorta to the blood pressure, to the heart. So this valve, competence of the valve, the health of the valve is also important. If the valve is tenosed or thick, preventing the flow of blood into the aorta from the heart during the cardiac contraction, then also it affects the cardiac output. So that means the, the whole amount of the blood cannot be ejected out to the aorta. So ultimately affecting the cardiac output. That means it decreases the cardiac output, and thereby blood pressure also may be lower. So in the other hand, if the blood vessel is if the aortic valve is incompetent, that means which the amount of blood which has been already ejected to the aorta during the systole, if the valve is not closed well, then, or incompetent we can say, then the blood again go back to the heart. It may go back to the heart. That is called regurgitation or incompetence. So in that case, again the volume of the blood which have been ejected during the systole will be affected, thereby affecting your blood pressure. Now we know about the blood pressure and uh, how it is affected by the different part, and which are the main determinant of our blood pressure, and how it is expressed, or how we can write the blood pressure. Okay, Now, how we can measure? This is the most important thing. So for measurement, there are many methods. Some are non-invasive, or you can say indirect method, like palpation, auscultation, flash technique, ultrasound Doppler, and oscillometric, or also known as digital method. And another method is called invasive. That means direct method. So the other, or only the palpation and osculatory method are important in our clinical day-to-day practice, because these are most conventional, easily can be done at the bedside, and all of us we can do easily if we know the method, how to measure blood pressure by these two methods. The other technique are used in some special purpose or in special occasions, and these are somewhat depends on some machines or some, and there are some also technically they are also somewhat difficult. So let us have the two methods, the palpation and auscultation, which are most commonly done and which are most convenient for us. So how is the palpatory method is done to measure the blood pressure? So first we have to palpate the radial artery pulse. So we have to here is the radial artery, and we can feel it. So then we have to inflate the bladder to 20 to 30 millimeter of mercury above the point of disappearance of the pulse, and slowly deflate the balloon to again, and while we are seeing the pulse. And during the deflation, at a point, the pulse will again reappear. So this disappearance and again the reappearance of pulse at a particular level of pressure of inflation is the point which approximate systolic blood pressure. And this has been taken as a point of systolic blood pressure. So it is a very easy method. Only you have to palpate, and during the palpation, the cuff is here over the brachial artery, that means arm. You have to inflate the balloon of the cuff, and you can see the pressure, how much you have raised the cuff, how much you have inflated the cuff slowly. And when the pulse is disappeared, that means at a point when you can occlude the blood vessel, that is the brachial artery over here, over your arm, then obviously your flow of blood will be occluded and you will not get the pulse. So this is the point of disappearance of the pulse. So after that event, you just inflate at least 2 to 3 millimeter above this point. Say at 120 millimeter of mercury, you can occlude the artery and there will be disappearance of the pulse. Now you raise the blood pressure to raise the blood pressure to 20 or 30 millimeter above that, above 120 millimeter, that means up to 150. Then you slowly decrease or deflate the balloon. So blood pressure will slowly decrease, say 150, 140, 130, 120. Again at 120, you can have the at the time you can have the pulse. So this is called reappearance. So disappearance or reappearance at that point is known as, or is taken as, a systolic blood pressure. It is a very quick method um, by which we can assess the systolic blood pressure, and it is approximately, it is not exactly same with that of the blood pressure measured by the other auscultatory method or other method. So about 10 millimeter mercury lower than which has been measured by the auscultatory method. But it is a very important method. We have to follow it and we have to do it. Even during the auscultation, we have to palpate. We should make a habit to palpate during even the auscultatory method. And another important thing by this method we can recognize is the auscultatory silent gap. This is a very important, because auscultatory silent gap you should understand, because in some patient, especially in elderly patient, where the blood vessel has been thickened by the atherosclerotic process or by the aging process, you can say, in making inelastic artery, then what happened? What happened if you only do the auscultatory method? So later we'll go how can we do the auscultatory method. So because we have to auscultate over this and we have to hear the sounds of the flowing of the blood through the arteries. So what happened in some patients, you can hear at the maximum point sound, then there will be no sound, that is the gap. Again, there will be reappearance of the sound. That means you do not, you will not continuously hear the sounds. So there will be gap, and that gap will mislead you. So if you mistakenly, without doing palpatory method, hmm, raise the cuff pressure somewhat lower level, then you can take in the lower point of appearance of the sound as the maximum point and taken as a systolic blood pressure. So you can miss the or we can miss the other point above that, the first appearance of the sound. We can miss, and thereby we underestimate the systolic blood pressure falsely. So there will be, if there is a silent gap, auscultatory silent gap, and if we cannot recognize it or fail to recognize it, then systolic blood pressure usually we measure is a wrong one, and it is a lower one than the actual. And in some patients like infant and children, we cannot, we have a difficulty to measure the blood pressure by auscultatory method. In that case, and even some clinical scenario in emergency room, sometimes we have to take the help of only the palpatory method, thereby knowing blood pressure alone, not the diastolic blood pressure. We cannot have the diastolic blood pressure by this palpatory method, but mere seeing of the systolic blood pressure in some situations, especially some emergency situations, gives lot of information, huh, for the treatment purpose. Okay. So these are the instrument which has been used for this method, auscultatory method. That is one. Also, it is the balloon is used during the palpatory method, and this is one, is the first one is the called aneroid, your aneroid instrument, the mercury instrument, which has been also known as sphygmomanometer. Mercury, that is the middle one, is also known as sphygmomanometer. The third one already we tell the digital. This is called electronic blood pressure instrument. So aneroid instrument, mercury or sphygmomanometer, then electronic. So auscultatory method, we usually your take the help of these two, sphygmomanometer, which is very much conventional and gold standard of all the method. We can say it is the gold standard till date for a clinicians or for a bedside measurement, and for every purpose. You can use this sphygmomanometer. It is not so costly. It is very much convenient, and it measure exactly without any. It's very accurate. Sure, it is also known as mercury manometer. So aneroid manometer is also used, but the drawback is that you have to calibrate this meter time to time. So how can we auscultate or measure the blood pressure this method? So control occlusion of the artery by pneumatic cuff. We have to occlude the artery by this cuff, and after this control occlusion, at every stage we have to hear the sound, that these sounds of the flow of blood through the partially occluded artery, some sound audible over the artery when it is compressed by the cuff, and this compression is gradually released. That means partial occluded. You know that if the blood flow or if anything liquid flow through a partially occluded vessels, it gives some sounds. So in our artery also, if we uh, block the artery and then it behaves as a partially occluded or completely occluded. If we completely occlude and if blood flows through this partially occluded artery, it gives some sounds. And that as per the your compression, how much it is compressed, and sound character will be different. So we will discuss. Then the cuff, for occlusion, we earn the bladder. The cuff, inside it there is a rubber bladder, and there is definite size. You cannot use any size in any patients. So for every patient, so every size of the patient or age of the patients, there is a definite size. So you have to know this. The bladder length, the cuff, that is the your inside that there is a rubber your bladder is there, and the bladder length, that is the bladder length inside this cuff, has to be 75 to 80% of the arm circumference. So bladder, at least it should cover the 80% of the arm circumference, and the cuff length should be long enough. The cuff should be long enough to wrap around the arm. So you can well wrap around the arm, and the cuff should be placed over this your brachial artery, and your bladder should be placed, and the cuff should be well your wrap around the arm, and width of this your cuff should be, or bladder, you can say bladder should be at least 20% larger than the arm diameters. That means it has to your at least 2/3 of the arm length. It has to cover the width. It should cover 2/3 of the arm length, like this. So these are the recommended size of the cuff. And for infant, for newborn, we have a definite bladder width and the bladder length as per the arm circumference. That is the mid-arm circumference, you can say, is measured here, and accordingly we have to use. But conventionally, what happened, which are available in the market for adult, it is the standard adult we are using. That means it is taken as the arm circumference taken as to be between among you say between 24 to 33 centimeter, 33 centimeters. So for that, we have a bladder width 12 to 13 centimeter, and bladder length 22 to 24 centimeter. So this is standard adult, has been used usually in the adult, unless your arm is very thin, or that means arm circumference is very low, like a children, then, and it is very obvious, if it is very thick, then we have to use the large adult size, or even in sometimes even the which has been used in the thigh, we have to use if the arm circumference is over that level. So this is the positions where we have to listen for the your sounds of the blood flow, which is also known as the Korotkoff sound, which is also known as the Korotkoff sound. So here it is showing that this is the position of the brachial arm. This is the muscles, and then in relation to that, that is the red one is the brachial artery, and we can palpate over here. That is called cubital fossa. Cubital fossa, that is the elbow joint. The cubital fossa anteriorly, and just at the point of middle, we can feel the arterial pulsation of the artery, and that is the known as brachial artery, which is just medial to and usually under the bicep tendon in the antecubital fossa, just medial and usually under and just medial to the bicep muscle. So we have to place the bell of the stethoscope directly over that area to get the sound. Which is known as Korotkoff sounds. So look at the antecubital fossa of the patient's arm and palpate the brachial artery. This location is the point over which the stethoscope should be placed to listen for the sounds which has been created by the flow of blood through the brachial artery, known as Korotkoff sounds. So you have to wrap the cuff approximately 2.5 centimeter above the antecubital fossa. So you have to take a gap of approximately 2.5 inch, and over here we have to place our bell of the stethoscope. So this is how we can determine, or we can feel for the pulsation of the radial artery. So palpate the radial artery to determine the palpated systolic pressure. Already we have told that is how we can measure the systolic blood pressure by palpation. So while palpating the radial pulse, we should inflate the cuff until we feel the radial pulse disappears. And also then we have to inflate to 20 to 30 millimeter of mercury above the point of disappearance, and after that we slowly deflate the pressure, huh? and rapidly deflate the cuff and also see the reappearance of that point, which is known as the systolic blood pressure. So note this pressure on this manometer, and we should rapidly deflate the cuff. Now, second part of this method is, you have now, after knowing the systolic blood pressure, now we should place our stethoscope lightly over the brachial artery just below the cuff. Then cuff should be quickly inflated to 20 millimeter of mercury above that systolic pressure, which has been estimated by the palpatory method. So then we slowly deflate the balloon or cuff at a rate approximately 2 to 3 millimeter of mercury per second. During this deflation, we should constantly hear by our stethoscope about the part of the sounds. So first appearance during deflation, there will be first appearance of the sound, which represents the systolic blood pressure. We should note that sound, which is tapping in nature. And slowly the sound characteristic will be sensed, and at a point the sound will disappear, and we should also note that point, and this is called, this point is diastolic blood pressure. In situation where this Korotkov sounds hard to the zero level, in some situations the disappearance of the sound, the Korotkov sounds, is up maybe at zero level, and there may be a condition even when there is no disappearance of the sounds. Then in that case, we should take the zero level at as the diastolic, means which when this condition happen, that means Korotkov sound hard to the zero level, then we take the sounds, the point of the sounds where it is muffled. That means already I have told that from the point of appearance of the sounds, when we deflate, the slowly the characteristic of the sounds are changes. So first it is tapping, then somewhat you're hushing, and somewhat after that at a point at the level of diastolic blood pressure, we can say in some situations it is muffled. So that muffle is taken as the diastolic blood pressure if there will be no point of disappearance has been detected in some patients. But in that case, we have to definitely mention that diastolic blood pressure at the point of muffling, say like 40 millimeter of mercury, and because sound has not been disappeared up to zero, so we have to mention that zero also. So it is written as, say, 120 systolic blood pressure slash 40-0. So immediately by seeing this, the one can understood that his systolic blood pressure is 120, and diastolic blood pressure is, because there is no disappearance of the sound at a particular level, so muffling is taken as a diastolic blood pressure, which has been as 40, and the sound is hard up to the zero level. So this is the diagrammatically I have shown here the phases and the Korotkov sounds. The phase, we can say the sensing of the sounds, characteristic of the sounds as a phase. So first phase, the appearance, phase one, that means the appearance of the Korotkov sounds. It is a thud-like, or you can say it's a tap-like sounds, very clear sounds. So we can easily hear that sounds and note these sounds, and it is taken, that is the appearance of the first sound is taken as a systolic blood pressure. In a normal average, say it is individual average, it is hard in and around 120 millimeter of mercury, and it is a systolic blood pressure taken as a systolic blood pressure. Then the phase two, there will be sensing of your characteristic of the sounds. So there are browsing, blowing noise. Then in phase four, it is a softer thud-like. So the level has been mentioned, say 110, it is somewhat blowing. At 100, it is somewhat softer thud. And say in and around 90, there will be, you can say phase four, softer thud, and then disappearing your disappearing blowing noise, and say at last at the phase 5 there will be nothing. That means you will heard nothing, so you can say disappearance of the cough sounds. So at the phase 5, so it around in average in an your 80 millimeter of 80 millimeter of mercury. So this point is phase 4 point, where you can heard any cough sounds. That point is taken as diastolic blood pressure. Diastolic, so you can say phase 5. Phase 5. So phase 1 is the appearance of cough sound, systolic blood pressure, and phase 5. Phase 5 is the disappearance of cough sound. That is called diastolic blood pressure. If there is no disappearance in some patient, the sounds can be heard up to the 0 level, then we have to take the phase 4, where the sound is muffled. When the sound is muffled, so then it is called, then it is taken as the diastolic blood pressure. Phase 4 is taken as diastolic blood pressure. So phase 1, onset of auditory sound, clear tapping sound, peak systolic pressure. Phase 2, onset of swishing sound or murmur, below say 10 or 15 millimeter from the peak systolic. Phase 3, a louder murmur. So here we can have, in some cases, as we will say, auscultatory silent gap occurs in these two phases. When the phase 2 sounds are fainter or not heard, so 15-20 millimeter below the phase 2. Phase 4 is the muffling, sudden muffling. Phase 4 occurs 5 to 10 millimeter of mercury above the true diastolic pressure. So it represents diastolic pressure in some situations, like in some patient with hyperkinetic state, like during say pregnancy, during severe anemia, that means hemoglobin is very low. In that case, these are the state, or even thyrotoxicosis, some thyroid disorders. These are the state we call hyperkinetic state. In that case, you can hear the sound even up to the 0 level. And in that case, when BP is measured, you should take the phase 4. That means the muffling of the cough sound as diastolic blood pressure. And you have to say also mention the 0 level, where actually the sound disappears, phase 5, during the writing of the blood pressure in this patient. So phase 5 is the disappearance of the sound, and which has been taken as the diastolic blood pressure. Diastolic blood pressure. So phase 1, systolic blood pressure, and phase 5, disappearance of sound, is diastolic blood pressure. We should know it very clearly, because we have to hear the auscultatory sound during the blood pressure measurement by this auscultatory method. And it is not difficult also, because first appearance of the sound is called the phase 1, and disappearance of the sound is called phase 5. So appearance of the sound is the systolic blood pressure, and disappearance of the sound is diastolic blood pressure. So this is how we can measure. I am showing here the arm where cuff should be placed, and the stethoscope over the cubital fossa just below the cuff. So what are the recommendation of the technique, recommended technique? So one, the patient should be relaxed. Patient should be relaxed. So as the patient enter the doctor's room, or anything where blood pressure checkup has been done, you should not immediately check the blood pressure. Ask the patient to sit or lie down for at least 5 minutes in a very quiet and calm environment, and patient should sit very comfortably, back supported, and also arm should be supported on the table like this. So you place the arm over the arm, or say the handle of your chair. So it should be supported, and it should be supported at the heart level. This is very much important. So you have to place the BP instrument and the cuff along with at the heart level. So heart level. So during supine, it is not difficult, but during sitting posture, which usually is the ideal way posture, you have to have take the help of the armrest and the table, where you should place, and the stethoscope at the level of the heart. So Before that you should ensure there is a no clotting or anything which constrict the any belt or any say chain or any cloth we should occlude your blood vessels or giving some hindrance to the flow of the blood through the brachial artery. So you should ensure that before you are applying the cuff. So the cuff must be at the level of the heart. The arms, if the arm circumference exceed or say we have already told the size of the cuff should be first selected as per the arm circumference. Okay. Then place stethoscope diaphragm over the brachial artery. Then the mercury should be placed very vertically. The column of the mercury should be vertical and inflate. We should first inflate the balloon to occlude the pulse over the radial artery and deflate it slowly. And inflate somewhat fast, but deflate slow. And it's slow at say 2 to 3 millimeter of mercury per second. And measure the systolic first sound and diastolic deep apparent sound nearest to 2 millimeter of mercury. So we have to always take the even number, not the odd number. So nearest 2 millimeter we should write. So what are the guidelines? So patient factor, patient should be relaxed. This is very much important because if you are in hurry and patient is in hurry and patient is very anxious and patient do not know what is going on and what to be done with him. So he may be very anxious or he may get anxious. So you should first explain what you are going to do and ask him to relax. And the room should be also quite comfortable, patient friendly. Then we should do one method to relax the patient. First, we can apply the blood pressure cuff at the beginning of our physical examination or history taking, and we can measure. Then we ask something, or we can do the other examination to elevate the anxiety of the patients. At the last, we can measure the blood pressure. And usually patients should be advised to avoid coffee, smoking at least before half to 1 hour before recording of the blood pressure. And some drugs which can elevate the blood pressure or lower the blood pressure. So like many patients, or it is a very over the counter, many patient takes, or even day to day also cough syrup, nasal decongestant. These are something which has an ingredient which has many that can increase the blood pressure falsely. So we should ensure that whether patient, that means patient before at least measurement of blood pressure, they should not take these drugs. And also whatever drug for treatment, say like blood pressure medicine, diabetes medicine, or other medicine, we should note what he is taking and we should make a record of that also. So position of the patient is next important. We should measure, this is the recommended in the during first blood pressure, first visit we can say the supine, that means in a lying posture as well as in a standing posture. During the revisit, and if patient are taking antihypertensive medicines or drugs, then 3, supine, standing as well as sitting we have to record. Then follow-up visit after that, only sitting posture is sufficient. Only sitting posture is sufficient. Or if the patient have some symptoms, especially related to the blood pressure, say postural symptoms, then if patient says he or she feels giddy or having vertigo or lightheadedness, even syncope, fall, so during the taking of these medicines or after taking of these medicines or even without medicines, then we have to measure the blood pressure in all the 3 positions like supine, standing, and sitting. Technical factor already I have mentioned. A cuff should be appropriate as per the arm circumference, and it should encircle well the arm, covering 2/3 of the arm. Mercury manometer you should use. This is the choice gold standard. Any right manometer require calibration from time to time. All four limbs should be checked in the first visit in adult. And in case of children, we can take the your one limb, even the lower limb also. Say upper limb, one lower limb. Use the arm with higher pressure in the follow-up visit. So usually our right arm, we should check the right arm, and the right arm pressure may be say 5 to 10 millimeter mercury higher than the left because of some anatomical variations. And during the first visit, because we should see in the all limbs, say both upper limbs, and in the pressure, say which recorded as the higher, say either or right or left, we should in the follow-up visit we should take that arm only. That means we should note the higher pressure only. So during the, at least we have to take 2 readings in the first visit. If the reading vary by more than the 5 millimeter of mercury, then we have to take the additional reading until the 2 readings are closed, and we should take the average of these 2 readings. For diagnosis of high blood pressure, that is also known as hypertension, we should at least 3 sets of recordings should be done at least 1 week apart, at least a week apart. In case of inaudible cough sound, we should make some maneuvers by elevating the arms, and we can ask the patient to close the fist for 4 to 6 times to empty the arm of pull blood and then rapidly inflate the cough. Then we can hear the cough sounds which has not been heard. So another important issue is that postural hypotension. Some patients have, even during treatment, or even without treatment also, some patient complains that as he stand up from a sitting or a lying down posture, or sometimes during the standing he have lightheadedness, giddiness, blurring of visions, even pre-syncope, even syncope fall. So these are called postural symptoms. What happens in a normal? What is the normal physiology? When the normal person, in a normal person, the blood pressure is maintained within the normal physiological limit in all positions. So whenever our physiology is within normal limit, then whatever the position may be, or sitting, standing, lying, show there is slight sense of blood pressure, and which has not been, we are not been symptomatic because of that, because our body can easily make up it by reflex mechanism. So prevents much fall. Say in a lying down posture, from a lying down posture, if a person stands, then what happens? The pooling of blood in the periphery because of the gravity, and thereby the blood flows to the heart, amount is less. So there will be low cardiac output, and thereby there may be fall of blood pressure. But in a normal person with a normal physiology, that will be well maintained by our reflex mechanism. So we not feel even any symptoms of that. So this is maintained, that called physiological limit. With a change in position from supine to standing, there is a slight fall of systolic blood pressure, not exceeding 5 millimeter of mercury, and diastolic blood pressure usually remain constant, or there may be slight rising. So this sends revert to normal within 3 to 5 minutes in a normal person. And this is some reflex mechanism by increasing our peripheral vascular resistance and heart rate by normal autonomic nervous system. But if that fall is more than 5, say if that systolic blood pressure fall by more than equal to 20 millimeter of mercury, or diastolic blood pressure fall by more than equal to 10 millimeter of mercury in upright posture, then it is called postural hypotension. Even without symptoms. But if the patient is symptomatic, say whatever I have already told, that your symptoms of postural hypotension are lightheadedness, giddiness, blurring of vision, extreme weakness, syncope. Even a fall of systolic blood pressure or diastolic blood pressure below that level, 20 or 10, then also it is called a postural hypertension. So we should very much vigilant about this also during the treatment of hypertension. So some common error which has been done during the blood pressure, which may your falsely record, we can false impression of the blood pressure, both systolic and diastolic. So we have to give very much important during the recording or measuring the blood pressure. So first thing is failure to record the correct reading. So we should exactly write whatever it is found during the auscultatory method or palpatory method at the say nearby 2 millimeter of mercury in even numbers. So we should inflate and deflate the cuff as recommended. That means inflation should be somewhat rapidly and deflation is somewhat slowly as it is mentioned, but not too rapidly, not too slowly. Because if we do that, that will alter the blood pressure. The blood pressure instrument has to be checked periodically because defective blood pressure or unrecognized defect in the blood pressure itself can alter or give an impression of a false reading. So over-reliance on the electronic apparatus. So electronic apparatus, even the aneroid also, we should regularly check at a regular time and calibrate. Cuff applied too loosely and too tightly. Also the cuff, we should not be too tightly applied or too loosely applied. So actually, when it applied appropriately, we can introduce one finger at the below the cuff in between skin and the your cuff. That is the pressure we should apply during the application of the cuff. Then inappropriate size of the cuff. So there is a recommendation of the cuff size to a particular children, adult, obese, elderly, arm, or even for lower limbs. So we have to, as per recommendation, we have to do that. Then failure to recognize the auscultatory silent gap. Already I have told. So in some patients, the silent gap give a misleading blood pressure. So we have to be very much vigilant about this gap. And if we do the palpatory method regularly in our during your recording of blood pressure by your auscultatory method, then we do not miss this silent gap. Failure to keep the arm and BP apparatus at the level of the heart. This is also very important because many a time we record or we place the blood pressure at any level, and we should ensure that it should be at the level of the heart. And BP measurement done as soon as the patient enters the room. Already I have told, because the anxiety or fear related to the or stress related to the patient may affect the blood pressure, very sufficiently affect. So patient has to be made very quiet. There's a comfortable environment, good positions, and a selection of a good during the blood pressure measurement. So now this is why it is important, because hypertension already I have told, that is called increased blood pressure is known as hypertension. And this is the only examination, the only method by we can detect a disease, which is very important disease affecting our many vital organs. So by measuring blood pressure alone or mere recording of the blood pressure, we can diagnose the commonest cardiovascular disease in the adult. So we have to be very much vigilant, and also we should know well about the methodology which have been described here to measure the blood pressure. Okay, thank you. Oh, sorry.